We face a new health challenge. Mpox is spreading globally, affecting communities and healthcare systems worldwide. It's a viral disease we must take seriously. The impact on public health could be significant if not addressed promptly. We've learned from the COVID-19 pandemic, early action is critical to prevent widespread transmission and protect vulnerable populations. This essay explains Mpox, its risk, and how to stay safe. Knowledge is power, and understanding the threat is the first step in combating it. Together we can overcome this emerging threat. Community efforts and global cooperation are essential in our fight against Mpox. The recent rise of Mpox is concerning. It highlights the need for increased surveillance and research to understand the virus better. It reminds us that infectious diseases can emerge anytime. We must be prepared. We must be vigilant, always ready to respond to new health threats. This includes understanding the virus, how it spreads, and the measures needed to control its transmission, and how to protect ourselves. Simple actions like wearing masks, hand hygiene, and vaccination can make a big difference. By working together, we can limit the spread of Mpox and safeguard global health. International collaboration and shared knowledge are key to our success. Mpox is a viral disease. It belongs to the same family as smallpox. The virus can infect humans and some animals. Symptoms include fever, headache, and muscle aches. Swollen lymph nodes are characteristic of Mpox. A rash often follows, developing into fluid-filled blisters. The virus spreads through close contact. This includes contact with an infected person or animal. Contact with contaminated materials like bedding can also spread the virus. Mpox is not as easily transmissible as some other viruses. However, it's crucial to understand the risks and take necessary precautions. Mpox was first discovered in 1958. It was found in monkeys, hence the name. The first human case was reported in 1970 in the Democratic Republic of Congo. Since then, outbreaks have occurred in Central and West Africa. These outbreaks were typically small and contained. However, in 2022, a concerning trend emerged. Mpox cases were reported in multiple countries outside of Africa. This marked the first time the virus had spread so widely. The majority of cases were reported in urban areas, highlighting the ease of transmission in densely populated settings. Section 4. The emergence of a more transmissible strain. Adding to the concern is the emergence of a new strain of Mpox, which has caught the attention of health experts worldwide. This strain, called Clade 1b, is more transmissible than previous strains, raising alarms in the medical community. It has been linked to the recent global outbreak, causing widespread anxiety and prompting urgent action.
Scientists are working tirelessly to understand this new strain, dedicating countless hours in the lab. They are studying its genetic makeup and how it spreads, hoping to uncover critical insights.
The increased transmissibility of Clade 1b is a significant concern, as it could lead to more rapid and widespread infections. It highlights the need for heightened surveillance and rapid response to contain potential outbreaks. It also underscores the importance of vaccination and other preventive measures, which are crucial in combating the spread. Understanding the evolving nature of the virus is crucial to staying ahead of the curve, ensuring that we can effectively respond to new challenges. Section 5, Combating the Threat, Global Response and Vaccination. The global health community is responding to the Mpox threat. The World Health Organization, WHO, has declared it a public health emergency of international concern. This declaration mobilizes resources and coordinates efforts.
Countries are working together to share information, track cases, and implement control measures.
Vaccination is a key part of the response. There are effective vaccines available that can protect against Mpox. These vaccines were initially developed for smallpox, but they offer cross-protection against Mpox.
Efforts are underway to increase vaccine production and distribution.
Section 6. Protecting yourself and your loved ones. Practical steps. In this section, we will discuss practical measures you can take to safeguard your health and the health of those around you. There are several important steps you can take to protect yourself and others from Mpox. These include
Avoid close contact with sick people or animals. This means keeping a safe distance from anyone showing symptoms of illness, whether they are human or animal. If you see someone with a rash, especially if it's blistering, keep your distance. Rashes can be a sign of infection, and it's best to avoid any potential risk.
Practice good hygiene. This is one of the most effective ways to prevent the spread of infections. Wash your hands frequently with soap and water or use hand sanitizer. Make sure to scrub all parts of your hands thoroughly. Avoid touching your face, especially your eyes, nose and mouth, as these are common entry points for viruses.
Be careful with bedding and clothing. Use gloves when handling laundry from someone who is sick. Don't share bedding or clothing with someone who has Mpox. Wash these items separately and at high temperatures to kill any potential virus.
Get vaccinated if you are eligible. Vaccination is a key tool in preventing the spread of Mpox. Talk to your doctor about whether the Mpox vaccine is right for you. They can provide personalized advice based on your health history and risk factors.
By taking these simple steps, you can significantly reduce your risk of contracting or spreading Mpox. Consistent and mindful actions are crucial. Remember, your actions can make a difference in protecting yourself, your loved ones, and your community. Stay informed, stay cautious, and stay safe.
Section 7. A call to action. Hope and vigilance in the face of Mpox. Mpox is a serious threat, but it is not insurmountable. By understanding the virus, taking precautions and working together, we can limit its spread and protect global health.
We have learned from past outbreaks. We have effective tools and strategies. It is time to act with urgency and determination. Get vaccinated if you are eligible. Share accurate information with your friends and family. Support public health efforts. Together we can overcome this challenge and build a healthier future for all.